All right, good morning, everyone. House Government Operations and Military Affairs, Wednesday morning, just after 9:30, May 13th. We are picking up work again on H588, Act relating to professions and occupations regulated by the Office of Professional Regulation. We are going to have some witness testimony in regards to a change the Senate made. And so we'll just get right to it and invite up Dr. Hildebrandt. How are you?
I'm well, how are you?
Yeah, thank you.
For the record, Rick Hildebrandt, Commissioner for the Department of Health. So about PEP and PrEP, right? The department does support this bill that provides access to both PEP and PrEP, both prevention measures for HIV. And we're okay with the way it's written now. We can work with OPR to implement this. It's a complex issue, though. This is not a simple one. It's not as straightforward as some of the other things the only other thing I came to talk to you before, which was the test to treat. And we do have to have some time to develop the protocols to implement this effectively because of the complexities associated with HIV prevention and the prescription. Okay, so that is going to take some time for us to work through with OPR. I did want to briefly touch, I know there was some discussion around testing in this committee. HIV testing is very, very different from some of the other testing we've talked about. This isn't a test to treat scenario. I have had patients who have tested positive for HIV. It is an incurable, potentially deadly illness. And invariably, when you discuss this with someone, it's very emotional. I come with my social worker and my counseling team to sort of start that conversation and discussion. If we were to talk about moving that kind of testing into a pharmacy, we'd be talking about a lot of structure that would have to be built in a pharmacy to help support that kind of dialogue and discussion. And I think that's part of the reason you're not seeing a lot of pharmacies around the country that are really doing HIV testing, because just the nuances associated with that test are pretty significant. And different than, again, the other kind of thing we talk about, whether it's flu or COVID or other things where there's treatments for, and these aren't chronic type of illnesses. Okay. So, just a little bit of a different nuance with that particular testing piece of this. But again, we really do want to ensure that people have access to preventive measures. And just given the nature of this, we would want to work closely with OPR to develop the protocols. Yes.
There you go.
Thank you very much. I really appreciate you coming in and giving us this perspective and also the information about the testing and how it differs from other conditions. How much time and does this bill allow for you to do a thorough protocol plan? Yeah,
that's a good question that I don't have an answer for in terms of time. I had discussed this with our policy folks sort of early on in the session, and had concerns because it wasn't something we had really worked through the nuances of. It's been a busy legislative session. We haven't had too much time to connect on it, but I just know that the protocol that we develop around this is going to take some time because it requires a lot more nuance than some of the other treatment sort of strategies we talked about. HIV medicines do have side effects, and they do require monitoring in some circumstances. Now, this is not intended generally for ongoing and treatment. It's intended for a preventative measure, but that's why you have to develop a really good protocol around it. So I don't have a real good answer for you around sort of timing. I just know it would take some time.
So I think that might be there might be a question that I'll ask later of OPR or council on the effective dates, because it's not clear where that one falls in. So back to the side effects, the ongoing treatments. Do you envision that the pharmacist dispensing this medication, it will be a short course of medication and then the advice to go to a primary care provider or other clinic for follow-up and continued ongoing treatment?
Yeah, and to be clear, the two are different, right? So pre-exposure prophylaxis and post-exposure prophylaxis are different animals in many ways, right? So a post-exposure prophylaxis may look like, oh my gosh, I found out that this person had HIV and I'm in an emergency scenario, or got kind of broke, whatever. I find myself in a scenario where I'm now in need of this and I need rapid access to this medication to help prevent me from getting HIV. That's very, very different than pre-exposure where you sort of are planning in a more thoughtful way, which may look very different, okay? So again, the two are different and generally the way, from what I understand, that these protocols are done in other places, it is a very, very limited, intervention and meant to meet a critical urgent need at that moment. And not intended to in any way supplant or replace what would be a therapeutic relationship with a provider and ongoing discussion. So that's why, again, frankly, part of the reason we really do need to do the work on the protocol, because we know that these are different and that there's a lot of work that we have to do.
Yeah, thank you. I hope that is the case, that it will be a very limited prescribing of the medication, and the individual will be counseled to seek ongoing medical assistance and not necessarily be allowed, that's the wrong word, because we want people to seek treatment, be counseled even more if this is a repeat occurrence.
Yep.
And it's clear
Right.
that they have not seen a
Right. Right.
disorder, because really the pharmacist should not be isn't aware of all the other conditions that a person might have. And
Yep.
so I think there needs to be a lot of guardrails, and I really appreciate that you're going to put a lot of thought into it in your department. So thanks for being with us.
Any other questions?
Any other questions for the commissioner? No, thank you so much for the input, sir.
Thank you.
And next, on to Zoom. Lauren Bodie, from the Legislative Liaison, Vermont Pharmacists Association. How are you?
I'm doing well. Good morning. Thank you for giving me a few minutes to testify. And I'll certainly be brief. As you know, we're just here to say that we do support the current form of this legislation, and certainly look to partner with OPR and Department of Health to help facilitate the creation of these protocols as appropriate. We have precedent in over 20 states that are currently using these protocols, and so I think we do have a good body of experience that we can draw from for crafting our protocols for Vermont.
You,
Yes, right, I know.
thank you. Do you see this as a big portion of a pharmacist's time that they will have to take continuing education on this particular protocol, this treatment, and what questions to ask, that type of thing?
Yeah, so pharmacists as healthcare professionals, we're used to doing continuing education to continue to support the development of our individual practices. This is no different than any other healthcare provider that we have in our system. And so certainly if there were a pharmacist who were interested in engaging and supporting their community by offering HIV PrEP, I would expect that if they did not have already the clinical knowledge and skills to provide that service, that is something that they would seek out in advance. And I say this because we do have practicing pharmacists in our states who are already clinical experts in providing HIV care and are in fact, certified by national organizations to provide HIV care. And so we do have pharmacists with that level of expertise currently in our state. We also have some, and I'm going to put myself in that number. If I were to begin to start offering this service, I would seek out a certification course or continuing education to ensure that I was offering the most appropriate patient-centered evidence-based treatment and providing that treatment in a holistic way to make sure that I'm providing appropriate care. And so that is the expectation that we hold all healthcare providers to, and pharmacists would be no different in that. To your question in terms of how much I would expect this service to be widely offered, I think that is going to vary by community. I think there's going to be some pharmacists and pharmacies that do lean into the service because they recognize that this is a way that they can support the community. And then there may be some where maybe this isn't as much of a pressing health need. I think the idea behind creating these policies and protocols is that we give healthcare providers to the tools to serve the patients in the way that patients need. And I think that's the beauty of like having a statewide protocol to allow the regulatory framework for local results.
Thank you. Does it depend on the pharmacy? Like, what if it's a national chain? Does the national headquarters have to make the decision that their pharmacists are going to offer this?
That is generally the case for our nationally owned chains, that there is not much local control in the way services are offered. That said, one of the things that we are seeing is given that, things like test and treat, HIV, PrEP, hormonal contraceptive prescribing, these are at this point broadly authorized services. And so we are seeing national chains leaning into this space. And so where maybe 5 years ago, when we first started, or 6 years ago, I guess now, when we first kind of started having these broader conversations about how pharmacists would prescribe for certain conditions, it was a little more patchwork on a state level. But really there is like quite a considerable amount of coalescing around the fact that pharmacists do provide these services. And so we are seeing national chains implement on a broad scale, pharmacists caring for patients in this way.
Thank you.
Any other questions? Well, thank you very much for the time. If anything else comes up on this, we'll definitely reach out, but we appreciate the insight.
Of course, thank you so much.
Yes.
Would I be able to ask OPR a question about effective dates if they can answer it?
Sure, happy to.
Thank you.
We got some clock to the next one.
Appreciate you being put on the spot.
Hello, Jen Colin from the Office of Professional Regulation. Good morning.
Good morning.
Morning. So my question is, under effective dates in this bill, I do see pharmacists listed in section 20A, and it looks like this shall take effect on passage. So how does that work within OPR when you have to work with departments and agencies that have complex rulemaking?
Yeah, so the effective upon passage is the authority to do the thing. So it doesn't mean that we have to be ready to go when it passes. It means that we have the authority to do the thing, but we're going to take the time, especially, with a more complex protocol, we're going to take the time it needs to ensure that there's patient safety built into all of the steps. So we'll be engaging in that. I would guess pretty soon, probably before the bill passes, we're going to be having conversations, and then we'll work on it till it's right.
Great. Thank you very much.
Okay.
Any other questions for OBR? No? All right. Thank you so much for that. Any thoughts from the committee in general on this proposal that's sitting in front of us? Done a lot of work on this bill, so there's been a lot of ins and outs through the different components, but I'd open up the conversation for a moment, but we have a few minutes before our next agenda item. Rep. Nugent.
I feel comfortable with it, and was glad to hear additional testimony this morning so that I have a better sense of the background for that part.
Same. All right, so I'm seeing affirmative head nods right now. Okay, so we have comfort with this as it reads, so we'll lock this down for now and we'll get it situated when the time's right. We're taking a position, but well, I guess. Well, actually, I'm not gonna say that. I don't want to jinx anything. We're not there. Tap the brakes. It is May. All right, well, with that committee, we don't have our next agenda item up for another 12 minutes, so we'll go offline until then. You do have a strike all amendment in your inbox for the cannabis bill that we're going to be reviewing with a couple of more items to speak to this morning. our Ways and Means Committee and the chair are anxiously awaiting the arrival of this bill. So I really would like to hold to the possible vote portion of the agenda today. So just situational awareness. That's why we left a good amount of time to have the discussion on the agenda this morning. SA is good.
Can you tell us if it's posted, Nick? Thank you.
And with that, sir, Nick, you can take us off until